Catholic morality, the vaccine and the producer agent. Approaching the morality of the COVID vaccine from an appraisal of the producer agent. The wrong agent approach. The producer agent approach. Most discussions revolve around the approach of the agent, meaning you or me in the taking of the vaccine. However, we should approach the deliberation of the vaccine from the agent producer, not the agent user. The integral act. Circumstances, object, intention, all these need to be present, but only one has to be good, but the others cannot be evil. Let us think of an example. Circumstances, COVID pandemic and its effect on the people nationally or globally. Object, vaccine produced by agent. Intention, to protect others from the virus, or money making, or political advantage. Object, the actual act. Normally a vaccine has stringent rules for production, including trialling and testing over a sufficient period of time, usually using animals or humans to verify possible negative side effects or unintended death. Were these followed? We do not know the intentions of those with political motives, e.g. depopulation. See intention. Intention. The intention of the agent. We have the problem of multiple agent intentions in the production of a vaccine, dare we say virus. We assume the agent has produced the vaccine to save us from the COVID virus, but is there an immediate danger of grave illness or death for most of us? Is there a long-term causal chain which has negative health risks from taking the vaccine? Do we know that the motive for money-making or political control has not meant a defect in the trialling and testing, especially consider the lack of time and prudence? Prudence being the key virtue, or as some would say, practical reasoning. Are the producers virtuous, or the seeming protagonists moral elites? Circumstances. Who, what, where, with whom, why, how, when. It is here that more scrutiny, analysis and questions are needed. I cannot go into all of these circumstances. Who? That is a question which needs careful scrutiny. Why? We have been told we have a pandemic, but mortality rates do not bear this out compared to previous pandemic ratios. Rather, it is the infection rate which is used to drive the idea of a pandemic and a consequent vaccine. The danger to life is remote for many in any given population except those vulnerable, which was the case with the annual flu virus, which has caused more deaths statistically, especially of the old and vulnerable, hence a flu vaccine. The integral act. Object, intention and circumstances make up one act. The principle of the integral good is that all of these are good and that none is violated. Can we say for sure in the production of a vaccine? Thus goodness arises from an integral cause, but evil from any defect in this integral act. Object, intention and circumstances must be either good or neutral. Can we honestly say that the intention and circumstances are good? Should we not ask questions? Can we answer yes to the principle of integral good not being violated? Cooperation. Bring the evil will of another to completion in an external act. Immediate. You join in the sinful act of another. For example, if those producing the vaccines have monetary or political motives not declared to the public. Mediate. You do something connected to another act which is sinful. If it's mediate, it could be proximate, which is immediately connected to the sin of another, e.g. selling poison to a murderer, or the ongoing use of aborted fetal lines, a living biological entity, not a remote immaterial object. Remote. Doing something which is later used for evil, e.g. giving land which is used to do sinful things. The initial act of abortion was evil, so any good fruit resulting from an evil act is morally sinful to accept. Cooperation, formal, sinful. You help someone to commit sin, e.g. it's evil because of the object and intention of the agent. Consent is given violating charity and the opposite virtue. Of course, this we cannot know in the case of the production of a vaccine except by public admission and verification. Material, sometimes sinful unless other conditions apply, and is thus permitted. You cooperate in a good neutral act which is abused by another to commit sins through malice. Yes, it is possible that many good people work in the production of the vaccine, but violate stringent safety principles because they believe there is a pandemic and a vaccine is necessary. Material cooperation. Indirect voluntary acts. It is lawful to do an act which has consequent evil effects, as long as 4 conditions are met. 1. The act must be good in itself, or at least indifferent, not sure in the production of a fast-tracked and unresearched vaccine. 2. The immediate effect of the act is good. The evil must come after the good effect. Otherwise, the immediate effect of evil must mean the act is evil. Does the evil effect from an aborted fetal line mean the act of the production of the vaccine is evil? 3. The intention of the agent is good, but cannot use evil means. May fail on both parts. 4. The agent has a proportionately grave reason for acting in permitting an evil effect, although not intended. Only material sin can be foreseen, but not formal. Seeming grave reason, yet there is no pandemic, so it depends on the knowledge of the agents. This is known then as the principle of double effect, e.g. a vaccine for COVID. We can never do evil, that a good may come, Romans 3:8. It is biblical and from natural law. Prudence dictates time, even at the expense of COVID, which in fact does not require speed if it is not a pandemic. A possible solution. That a group of Catholic representatives, morally in good standing with the Catholic Church, and of sufficient formation, who are connected with particular pharmaceutical vaccine producers, are able to advise moral theologians as to producer agents' object, intention, and circumstances of the integral act of producing the vaccines. This may alleviate the conscience of many Catholics and heal a lack of trust in authority in relation to the vaccine.